time limits that we have established a tradition of in these settings. So within an hour and a half maximum, we'll be out of here. Let me begin by just reporting on the current status of the information on testing and recoveries. In the last 24 hours, 2 samples have tested positive for COVID-19, bringing the total number of confirmed COVID-19 cases in Jamaica to 509. The newly confirmed cases are male, 48 and 74 years old, from St. Catherine and Kingston and St. Andrew, respectively. One of the positive cases is a contact of a confirmed case related to the workplace cluster in St. Catherine. The other is under investigation. In terms of recoveries and deaths, of the 509 cases confirmed with COVID-19 to date, in the last 24 hours, 13 more patients have recovered and have been released from hospital. This brings the total number of recoveries to 113. This is a recovery rate of some 22.2%. And you would have seen that in the last week or so, we have seen a fairly high increase in the number of recoveries, which is a very positive development and in keeping with our expectations given when we discovered the first positive case. 9 persons have died, unfortunately, which is a 1.8% death rate of the total number of positives, which by benchmark numbers based on the short history of the virus is relatively low. Nevertheless, every life loss is a loss, and we regret that. But 9 persons have died from COVID-19 to date. There are now 387 active cases. Of note, there are no moderately or critically ill cases at this time. And that is again worth highlighting, that for the most part, and as of now, the positive cases are cases that are not critical or even moderately ill. These are persons who are primarily asymptomatic, and we can comment more on that later on. In terms of the classification, Jamaica now has 41 imported cases. 193 cases are contacts of confirmed cases. So 25 cases are import-related, 61 are related to a local transmission cases, not epidemiologically linked. 96 are contacts of employees in the workplace cluster in St. Catherine. 11 are contacts of confirmed cases under investigation. 24 are local transmission cases, not epidemiologically linked. 251 are under investigation. 224 of those under investigation are linked to the workplace cluster, and then there are 27 others. Some 305 or 60% of the confirmed cases are females, and there are 204 or 40% males, while the ages of all confirmed cases ranges from 2 months to 87 years. The community quarantine in St. Mary, the Dover, Enfield, and Anota Bay communities remain under 14-day quarantine with effect from Thursday, May 7th, 2020 at 6 a.m. to Thursday, May 21st, 2020 at 6 a.m. That quarantine arrangements are in effect. We have announced the actual boundaries and the restrictions, and when they apply, when they are eased up for persons to do shopping, that is a matter of public record, and that continues. We want to just remind the public, or in particular those in the zone, that mobile pharmacy services are available for persons who need those services. So in the case of Enfield, on Tuesdays 9 a.m. to noon, Dover Thursdays 9 a.m. to noon, and Anota Bay Saturdays 9 a.m. to noon. The mobile NHF pharmacy drug serve window is available in those communities during these days and times to allow persons who have requirements, medication requirements to access their medication. In terms of food packaging distribution, of course, the Ministry of Labor continues to do that, and persons who may have particular needs or require additional information can get that information either by calling the 888 One Love number or by reaching out to the contact tracers who are in the community on a regular basis. 426 patients are in isolation currently. 123 persons of interest are in quarantine at a government facility. So we continue to use the isolation and quarantining methodology to hold persons based on the needs of those individuals. In addition to that, we've had 3 flights, 2 today, and those numbers are approximately 96 from New York, 96 from Fort Lauderdale, and 18 from Canada. So you can do a quick math there and give me the total. That looks like, I'll give you that shortly, just to be absolutely sure. But we have had these persons come in today. I'm sure the Ministry of Foreign Affairs and Foreign Trade, the Minister herself, was on hand and will give better particulars about those persons. But 210 persons came into the island, and they have been or are being processed and dispatched in an appropriate facility, as was the case with the previous flight that came in from the UK. In terms of testing, so far we have tested 7,552 samples, 6,998 are negative, and we have 55 pending. I want to use the opportunity in having given these numbers just to remind Jamaicans that we have to remain vigilant. We have taken some decisions around relaxing some of the restrictions, and we're going to be having a discussion post the media brief segment of the program with individuals who are involved both in the church leadership of the country to get some feedback on the lifting of those restrictions, as well as persons who are involved in the bar industry to get similar feedback. And the 100th patient who was released yesterday, which for us is a milestone. And so we'll have a short conversation with those 3 categories of individuals. But in the meantime, we say to persons, remember, continue to observe the restrictions, staying at home, the maintaining physical distance, 6 feet from each other, avoiding crowds to the extent that you can, or please do that, wearing a mask while you're in public or in crowded situations, and of course, sanitizing, frequently washing hands and sanitizing as needed. Jamaicans are also encouraged to always remember to cover your mouths and noses if sick or when out in public. And of course, if you need further information, call the 888 One Love number. So that's it for the update on the most recent figures. And I believe we should know the top 2 pages. Okay, sure. So the top 2, the key data that would be most current would be 2 additional positive tests in the last 24 hours, which brings the number to 509, 48 and 78-year-old males from St. Catherine and Kingston and St. Andrew, 1 linked to the workplace cluster and the other under investigation. 13 patients have recovered and released, which brings the number to 113. 9 persons have passed 1.8% of the overall number, and 387 active cases that are being continue being monitored and processed. So that's the recap of the numbers for today. And I will now pause and allow for questioning. Thank you.
Thank you very much, Minister. And we want to remind our media colleagues to use the raise hand feature. We want to apologize for the audio quality. Hopefully we're getting a better feed now. For those who have questions, just to use the raise hand feature on Zoom, and you can go ahead with your question. Just identify the media entity that you're from, your name and the entity that you represent, and your brief questions. All right, we're going to go to Jamaica Social.
Can I go ahead?
All right, we're going to go to Jamaica Social.
Hi, good evening. I'm Cassius Watson for Jamaica Social. Minister, those figures are quite encouraging, and many Jamaicans are reacting to that. Can you say what is the rationale behind, as far as we understand and have been hearing, regarding how you make that decision on loosening things or freeing things up? As far as we understand from the World Health Organization, you must have no cases for 14 days, no new cases before you can consider yourself to be in a safe space. With understanding that, why did you decide to go the route of bars and churches that congregate thousands of people? Literally this weekend, thousands of Jamaicans will be coming together. Are you not concerned about that?
Right. I think but first of all, I'm not sure that the World Health Organization says you should only relax movement when you have no new cases for 14 days. In any event, countries are allowed to adjust based on the context that they are in and take decisions based on their particular circumstances or situation, which is what Jamaica has been doing, although we are certainly guided by that body. The decisions that are taken, and the Honourable Prime Minister spoke to them, I think, at length, both in the Parliament and in the press brief on Monday, are taken in the context of where we think we are as a country, the context of a life and the need to allow Jamaicans to access certain basic essentials, whether it is their place of worship or it is another place of relaxation. The protocols that accompany those decisions are intended to mitigate against the risks that are clearly posed from relaxing the restrictions. And frankly speaking, there is no risk-free approach. It really is about how do we gradually resume normality of life while managing the risk of COVID. And it can't be that we wait until we have no cases for a prolonged period of time, because the chances of that, frankly speaking, could be remote based on the spread of the disease and the history of the disease across the world. I don't know of any country where activities only resume after you have had no cases for 14 days. So we do appreciate that there are risks involved, but there are other factors that have to be considered, and the protocols around the freeing up of bars and churches in this case, as explained by the Prime Minister, are also aimed at mitigating against those risks.
Thank you very much, Minister. We're going to go to Jamaica Observer.
Minister,
Yes.
quick check for you. The persons who came in today were also hauled from the Jamaica Observer. Were they tested for COVID before they left the United States, particularly those who were coming in from New York, which has been the epicenter of the virus in the North America?
I'm going to ask the Chief Medical Officer to respond to that.
Right. On the JAM COVID app, there is a question that is asked if persons have been tested. There is not a requirement for testing, but the information on testing is taken on the app. I'm not able to report how many persons from this batch had indicated that they were tested and what were the results. But it is we do not have it on the app as a requirement, but the question is asked if a test has been done.
Thank you very much, CMO. I'm going to go to Brittany Clark.
Hello, good evening, or good afternoon rather. So my question is, there are a number of persons complaining that they have been tested beyond the 14-day period, have been in quarantine as instructed, but they are yet to receive their test results. How long does testing generally take, and is there a system of prioritization being utilized, which kind of affects the rate at which persons receive their results? Thank you.
With regards to results, as soon as we get the results from the laboratory, the results are then sent to the regional health authorities and it is disseminated from there. We do recognize that there was a problem in terms of the fact that persons were moved out of the region in which they were tested and the parish that they were tested to a site for isolation or quarantine. I believe that the problem that you are indicating arose out of that situation where results were actually present in a parish and were not transferred to the other parish in a timely manner. So we have been working to rectify that situation, and I do believe that as of today, that situation, what I know as of today, it has been rectified. I'm not sure at how many days before, but it has been rectified.
Thank you very much, CMO. We're going to move to Giovanni Dennis.
Hello.
Go ahead, Giovanni.
Okay, thank you. Minister Tufton, Anthony Fauci, the head of infectious diseases, or the lead infectious disease expert in the U.S., was warning lawmakers just this week of the dangers of reopening their economy too early. Yourself, on a tweet from your account on Monday at around 1:14, that's now apparently deleted, shared a report from the Business Insider about Seoul reporting a spike of 40 cases because of the reopening of bars and clubs. Did you personally agree with the move, Minister, to reopen churches and bars, if even partially, and how concerned are you that doing so may lead to a spike?
Thank you, Giovanni. Well, the decision that Cabinet takes is a collective one, and I certainly identify with the decision. So yes, we discuss matters, we take decisions, and we support those decisions, and that certainly was the case here. The decisions, as I said earlier from the previous question, is not, however, taken without some appreciation for the risks involved. And, we have never, certainly not in the public health team, including myself, have we not highlighted that with every decision there are risks. But with every position taken, whether to restrict or to open up, there are other risks that are involved. And so, yes, there are risks with opening up and allowing persons to congregate. Yes, there are risks with persons who may go to bars or churches for that matter. the protocols accompanying those decisions are intended to mitigate against those risks. That's the first sort of check and balance in protecting or in minimizing the potential negative consequences of those decisions. The other, however, is to pull back on some of those decisions. And I believe the Prime Minister was quite clear that this is a period of trial, if you will, probation, if you will, that persons are expected to comply. There will be an inspection, random inspection or otherwise, and should there be an outbreak that is identified with persons not complying with the protocols, then the Cabinet reserves the right to withdraw or to suspend the decision that has been taken. And that's what happens in other jurisdictions also. So we're not different in taking these decisions, and we certainly wouldn't be different if we were to pull back on those decisions if we recognize that there was a risk. What is very important, however, is for us to recognize that at some point we're going to have to gradually move back to a place where persons can lead normal lives, even with COVID present in the population. And so it really is an attempt to start a process and to manage that process with the protocols that have been introduced so that we can overcome the risk while at the same time giving Jamaicans the opportunity to function in their normal environment.
Thank you very much, Minister. We'll go to Emma.
Yes, hi. Good evening. I'm Emma Lewis. I'm a blogger. And I have a couple of very quick questions. Sorry, it's 2 questions. There's been a shift in emphasis from the number of positive cases to the number of beds in the hospitals. Why are the number of positive cases, not so important anymore? Now that I heard something about, well, we passed 500 cases, but let's not focus too much on the numbers anymore. So that was one. The other one is, how is the hotline going, and what has the response been? How many referrals you've had, and so on?
I'll probably ask the CMO to speak to the hotline. I don't have the details of it. I know that persons are in fact responding, and it has been a useful addition, and the website for that matter. Persons are logging on and are making applications and expressing themselves, requesting assistance, and so on. I don't have the specific data. On the issue of shifting emphasis from positive cases to other variables, we've tried to give all the key variables in our press brief. But the truth is that over time, the country will have to learn to accept both in theoretical terms, but also in terms of how they live within their environment, behavioral terms, that COVID is going to be around. It will represent a risk, hopefully over time, less of a risk based on modern medicine, based on certain practices, based on the immunity that we develop as a population and as individuals. And really what is important is how we manage or contain or minimize the severity of the impact. So recoveries is a very important variable, because it says to the population, or should anyway, that COVID is not a death sentence. Most people will recover. And that is the experience of all countries. Deaths is a negative consequence of COVID, and you want to minimize, or if you can, eliminate deaths. And the fact that we have 9 of the 500 plus cases is a good record, even though we regret all deaths, obviously. So the question is, what are the experiences we have learned from the deaths? Well, one experience confirmed by other jurisdictions, but certainly in our case, is that all 9 individuals had underlying conditions. And so they were hypertensive, they were diabetic, they had other ailments that compromised their immune system and their ability to resist or to manage the virus. What's the lesson from that? Persons with underlying conditions have to be particularly careful, have to take the extra precaution, and in terms of the public health response, we have to have hospital beds, ventilators, ICU rooms to cater to the possibility of those persons being infected. And so we have been building that out. So hospital beds become important. We have over 300 COVID beds. We have a number of high dependency units. Some are being put in place. We've brought in a number of ventilators with additional ones to come. This is all in preparation for those who are going to be impacted in the most severe way in order to minimize the loss of life. And we have to learn from every single experience. So all the data is important, but to be totally frank, over time, I would hope or wish that the Jamaican population places less emphasis on the number of positives, because COVID is going to go through and affect a lot of us, and place more emphasis on our capacity to cope as a public health response with those who require hospital care, and of course those who require it at the most severe level. And I think that will create the kind of balance and manage the expectations and the fears and the responses that I think is important to deal with this scenario. I don't know if the CMO wants to come in and speak to that, or just focus on the hotline issues.
Yes, thank you for your question. The reality of it is that COVID is here, and we now have 507 cases in the country, 509 cases in the country, positive cases so far. Some have recovered, but we do still have some active cases. It means that we will continue to see cases, and that these persons who are positive will have exposed others to the virus. But what has been our experience so far in the country? So far, of the 509 cases that we have seen, the positive cases, the majority of these are asymptomatic. And of those that are symptomatic, very few persons develop symptoms. Of the persons that develop symptoms and have to be hospitalized, we really, on review, have found out that only 21 persons of the persons that have been hospitalized really needed hospitalization. So we've moved from a phase where we are hospitalizing still persons just for isolation purposes to prevent them from spreading the infection. But many of those persons have no symptoms, and some have very mild symptoms. So our experience with COVID-19 so far is that very few persons get ill. Now, we have had 9 deaths, and that is always a serious contemplation. But the reality is that we will get more cases of COVID. We would want to protect the population that is vulnerable, because we see that the persons that have developed illness requiring hospitalization and those that have died fall into the at-risk groups in terms that they are elderly or they have comorbid illnesses, or sometimes both. So yes, there may be a need to shift our attention at this time from the number of positive cases, because that is going to go up, and start looking at the numbers that are really getting ill and how it is that we cater for these persons to ensure that they are detected early, that they are treated early, and that we can protect them from getting serious illnesses that can lead to poor outcomes. So this is really a time for the population to shift its focus a little bit. When we had no cases of COVID, we were always interested in how many positive cases. But now, as we have 509 cases, we must expect that we're going to get more cases. We now need to look at how we manage those that really need care, and how it is we protect those that are at risk. With regards to the calls from our different call centers, we are in fact getting a decrease in the number of calls that we usually receive. Most of the calls that we're getting at this time are persons who may call to say that they have respiratory illnesses and that inquiring about the treatment that they should receive. And the parishes that we're getting our most calls from are Kingston and St. Catherine, St. Elizabeth, St. James, St. Mary, and Clarendon. I don't have the exact number of calls, but what I see is that there certainly has been a decrease in the number of calls over time. Thank you.
Thank you very much, Semo. We're going to go to Akira.
Hello, good evening. Are you hearing me?
Yes, go ahead, please.
Okay, so I've heard complaints about the quality of food and service in a particular isolation facility. Just wanted to find out if the Ministry of Health is aware of this, and if so, what is being done to address the issues.
Okay, good afternoon, everyone. The Ministry of Health and Wellness have become aware of complaints that we are receiving from our citizens that are being accommodated in our isolation and quarantine facilities. At this point in time, we have engaged the management of the different venues, and we are in consultation to determine the nature of the complaints and to see how we can best improve the quality of service that is being offered at the facility. We do also recognize, though, that there is a level of frustration in terms of being outside of your normal comfort zone as an individual for such an extended time. However, we require that there be 2 negative tests done before we can release anyone from isolation. And sometimes persons remain positive for a considerable length of time. Our experience right now is showing an average of about 30 days for persons to return a negative test for COVID. And so sometimes that can heighten persons' anxiety and frustration for being confined, really, for such an extended period of time. We recognize that, and we take note of the complaints, and we are making every effort to improve the service delivery.
I just want to add to that by saying that we need to accept that this is a highly contagious virus, and the intention is really to minimize the spread. And to the extent that persons have the virus or have to serve the period of quarantining that is required to ensure that they are virus-free, we have to stick with those arrangements. It's very confining. It's very restrictive. It does have the potential to affect the state of mind of individuals who would otherwise be free to move around. And so it can cause persons to react in a very negative way. Even though your persons are placed in a building that is a hotel, it's not that it's a holiday service that is being offered or is going or is available. It really is a hospital service. And not to take away from the quality of hospital services, but the restrictions, if nothing else, are going to apply. And so persons are going to be prevented from moving around. There are going to be sanitation measures that will take place. The diet is not going to give you a lot of options. Persons must be treated humanely, and we take all the concerns seriously. And to the extent that we have those concerns expressed, we will investigate and will correct to the extent that they need correcting. But just to say it's not going to be a perfect situation given the circumstances and the context. And so we ask persons to be patient. It is for their own good and certainly for the good of their families and community and country. And we will do whatever is necessary to ensure that they are treated humanely and that they are given the clinical support so that they can rid themselves of the virus in one way or the other, so that they can be reintegrated sooner rather than later.
Thank you very much, Minister. We're going to go to Zara.
Hello, everyone. I'm with 18 Degrees North at 18dn.substack.com. I'm asking the CMO one question and then the minister another. The CMO, could you say for the people that have asked by phone or by the website, how soon can you expect to be tested once you've asked?
I can't give you an exact answer where that is concerned because there is an appointment system. And so if the appointments are filled for one day, then you would be moved to another day. So when you go on the website, you should see the days that are available to you. And if persons have not selected, then the health department usually gets in touch with you and arrange a time. So it's really difficult for me to predict in terms of what is happening in one particular parish compared to another and the kind of time period. So I would say, Zara, you should probably give us a little time. I mean, this week we have been checking to make sure that all the parishes have their sites up and that they're ready to go. We know that we have some internet problems that we are trying to work out within some of the parishes, and for that, different persons are trying different initiatives to get around it. So we have some kinks in the system to work out where that is concerned. Probably we should give us a little time to be able to review, to be able to provide a feedback as to how well this is working and what is a turnaround time that would be expected.
Okay, and my second question, for the individuals that we are learning about that were exempted as incoming passengers when the restrictions were on, those exempted passengers, have there been any positives that have resulted?
Exempted from, sorry?
The general rules, are you hearing me?
Yes, I'm hearing you. You said
Sorry.
individuals have been exempted. I'm trying to understand. Exempted from what?
Okay, so for instance, the ambassador and
Oh, I
the
see.
other
From the
diplomats that were
government, from the government
yeah,
facilities.
that were approved by the,
So-
by the government for them to come in as
Right.
incoming.
So just to be clear, that the fact that you have been, the quarantining applies whether in a government facility or a home facility, and exemptions, of course, take place based on the circumstances and the particular context. At this point in time, for the most part, persons are placed in a state facility, but there have been a few exemptions. But nevertheless, the terms of quarantining applies. So persons are still tested, they are still monitored, they still serve the particular time. I'm not aware that any who are non-government quarantine have been tested positive. I'm being told by the CMO no. So the answer to that then is no, even though some are still in the process, the quarantine process, so one will have to wait until that process is complete. But as of now, no.
Thank you very much, Minister. We're going to go to Dion.
Thank you so much. Two questions. One, we received a call a short while ago from someone we know personally who is extremely credible, who said that their relative came into Kingston this morning, 9:30, and they arrived at Bahia Principe at 3:30 this afternoon. They've been sitting in the bus since then and have been told there's nobody to take off their luggage. Can the minister tell us what's going on there and why this is happening? My second question relates to something the CMO said. In fact, she framed it beautifully in terms of the numbers of people that we've had or have not had getting ill. Clearly, there's something happening here. We're not being badly affected by COVID. It's not only, in my view, about the government's measures, because everywhere you go, you see people are bungled up, you see crowd all over the place, and a lack of distancing. Is the ministry aware of or participating in any kind of clinical investigation or research at this point to figure out what's going on? Thanks.
Do you have information on the arrivals? First question. In terms of that particular case, let me ask the PS, who may have more information than I, as it relates to persons transported to the facility.
Well, no, this is information that is being provided to us at this point in time. Our feedback from the center is that three flights came in. One flight came in at the hour that about 9:30 this morning, thereabouts, and that flight was processed, and the persons were taken directly to Bahia Principe for further processing and health checks. The second flight came in, and all of the processing was done at the airport, and that is a logistic arrangement that was worked through to ensure that we didn't have the commingling of the two flights in any one location. I am uncertain as to why there would be persons on the bus waiting because of luggage not being able to be taken off. So we'll have to investigate that and provide some feedback on that as soon as we have more the specificity of what has occurred.
Just to note, though, that it does take some time for the processing to take place, and maybe CMO can comment a little on that, but it's not a straightforward disembarking, boarding a bus, and then being transported and checked into a facility. It's about a registration process, getting personal details, doing the testing, as I understand it, or collecting samples. There may be special needs for some persons, and I could go on. So it is an administrative effort, and I could see persons waiting for a while. I'm not sure about the specifics of this particular case, but it would involve some wait.
Yes, thanks for your question, Dion. I don't want to answer to say that maybe we're just lucky, but the quick answer to your question is that yes, we are involved in research programs. The ministry has a research group that is looking at several areas in terms of what is happening with COVID, including clinical management, and also in terms of population studies to see how we can explain some of the things that are happening in our population. I must say that what is happening in our population in Jamaica is pretty much similar to what is happening in other Caribbean countries in terms of the numbers of cases and the relative proportion of the critically ill persons. So it's not a position that is unique to Jamaica, and there may be many things that are related to that. I'm not going to try to hazard any guess right now. We continue to monitor, and certainly if there is anything that is going to be immediately obvious to us, then we will share with the public. But I think that we will have to rely now to continue to collect the information on the cases. We do really have a very small number of cases in terms of the moderate to severely ill persons. So in terms of saying why is this so, we're not able to answer that as yet.
Can I come in here? No, the CMO is short selling herself and the team, and I have to intervene. First of all, let me say I'm the least of the apostles in terms of the success that we have had. And we have had some successes, and we shouldn't be too shy about saying it because it means that persons are working. The reality is that the public health response to this public health challenge, which comprises of thousands of persons across the length and breadth of the country, decisions taken at the level of the government to initially restrict travel in the first instance from the point of the origin of the virus on the 30th of January, then later on to 4 or 5 other countries, expanded to 8 countries where we felt the virus was raging and clearly being exported by its citizens, then restrictions as it relates to other forms of activities, and then having had the virus come to Jamaica, the contact tracing. I'm going to invite the public, the media, to the extent that they can expose themselves to the public health nurses, to the public health inspectors, the community health aides, those that I spent a little time with in St. Mary on Saturday. The work that they do once identifying a positive case, to interrogate, to visit homes, to interview, to temperature check, to quarantine, to isolate. For me, they are the heroes of this fight to date. And yes, we have had cases of crowds in a number of settings. We've all seen it. But frankly speaking, we have taken a very targeted approach based on an assessment of the risk, and where those risks are greatest in terms of positive cases, we have sought to cauterize by surrounding those areas and individuals and trying to manage. And I think that, frankly speaking, has been a big part of the success. Now, what will happen in the future? It's still very early days. We don't know for sure. As we open up, we're going to be faced with additional risks. But I am prepared to say, up to this point, the public health response, led by the Chief Medical Officer and her team, the Permanent Secretary, and the team in the field at the parish level, have been nothing short of exceptional, and it has cauterized this challenge. And I think Jamaica owes all of them a world of gratitude for the efforts that they have put out to date. And let's hope that we can collaborate going forward to keep it that way. Thank you.
Right. Thank you, Minister. I was really answering with respect to the severity of the cases, but with respect to what the Minister has said, I do want to put in a point to say that the early detection of cases would have prevented the deterioration of persons, and therefore that we believe would have an effect on late presentations, and therefore the proportion of persons that we get that are mildly ill. So if it is that we had not detected persons early, then it possibly could have led to them deteriorating, late presentations, more moderate illness presenting to hospital. I also want to just mention in terms of our public education program, because a lot of our patients and our positive persons as well also took the initiative to come in and to bring themselves to attention. And I think that the public education program that we started very, very early, and Jamaica has been recognized in several forums for this, because we started to educate the public from in late January in terms of early recognition of the problem, recognizing that there was a problem, and therefore many persons acted on that and sought help early, and we were able to detect early and treat early. So that also would have contributed to less moderate to severely ill cases.
Thank you very much, CMO and Minister. I'm going to go to Andre Williams from the Gleaner.
Good afternoon. Are you hearing me?
Yes, go ahead, please.
Good afternoon. Andre Williams here from the Gleaner Company. Minister Tufton, we understand that as part of the proposed protocol in the tourism aspect is that persons who are going to travel here when our ports are open, they will be required to have a medical certificate of no older than 76 hours. We would like to know, how do we safeguard against that? Because persons moving between airports may become infected with the virus and hence bringing it here to Jamaica. Will we test these persons again on arrival, or will the medical certificate hold regardless?
All right, so we're working on the protocol, so I'm not sure where you'd have gotten that information about established protocol. I mean, we have protocols now, but those protocols are being reviewed in light of the new public health threat. And so what I would encourage you and the public just to hold a bit until those are established. I don't know if the CMO wants to comment further on that.
Yes, I recognize that there are a lot of countries and entities that are speaking about tests on entry or test on exit for travelers. However, I think we have to be very careful about those decisions, because the tests that are done, first of all, you have to look at what tests are done, and many times these are rapid test kits that are being provided for persons in transit. So the test results are not reliable, one, and two, the test result speaks about no. So if a person is incubating a virus, then they may very well have a negative test, and then 2 days later, when they're in country, they develop symptoms. We have seen that in some of persons that have returned to country that would have been tested before they came in, that would have had negative tests, and then once in country and we've tested them again, they would have developed a positive test. So we know that that is a here and now. It gives you the status now. And so therefore it does not take the place of an observation period, which is the duration of the quarantine period, which is 14 days. But as time goes by, we will review what are the protocols that are necessary. But we have to be careful how it is that we utilize tests for that purpose.
All right, thank you very much, CMO. We're going to go to Old Harbor News.
Hi, good evening, Minister, and good evening, CMO. Question, CMO. What particular drug are we using, or perhaps set of medications are we using to treat COVID-19 patients in our care? And do we have adequate supply of that drug in the short, medium, and long term? Thank you.
The treatment of the patient is going to be dependent on the symptoms that they present with. And so, therefore, there are some routine empiric kind of treatment that we would give in terms of, for example, the treatment of influenza-like symptoms until we have an influenza test that is negative. So we may use specific medication for that. And then we may also use certain empiric antibiotics where we think that there's a possibility of secondary bacterial infection. Those medications are in fact available in country. We do not have any shortages of these medications. And so far, in terms of the management of our cases, we have not had any shortages, and we continue to have a supply within our storage areas, so we have no shortages there.
Thank you very much, CMO. We're going to go to our two final questions. There are follow-ups from Giovanni and Brittany. We're going to take Giovanni first. Let's try Brittany Clark.
Hello, good evening again. Just a follow-up for CMO for the question I asked earlier. I just wanted to know, is it recommended that persons contact the regional authorities associated with the parish that they were tested just to check on their results if they've not received them? If not, what's the procedure for persons who wish to follow up? And my second question is, today we understand that only the state-owned media entity, JIS, was allowed to interact with those Jamaicans who return to the island today? Is there a reason for that? Is there a new protocol that we should follow? Thank you.
Well, the management of the process there was handled by another ministry, but still part of government. I'm going to hazard a guess, at best, to say that there are some confidentiality issues around persons' personal information and so on. I mean, if persons coming in, it's a special arrangement. It's in the heights of the discussion around COVID and who is positive and who isn't. And, we try to not expose persons unnecessarily unless they give permission so to do, even the ones we interview on this program. The stigma, too, is a big issue. So it really is just showing some respect for the privacy of individuals, I would imagine. And I think that's quite appropriate. So I don't think it was any intention to be, to leave out the media or be disrespectful to them. It's really a function of just observing the privacy and giving some protection to them, to those who came in.
Right. The release of results are always going to be done in a certain way to ensure confidentiality of information. I don't think that if anybody just calls the regional health authority that they're going to get a result over the phone like that, and so I would discourage persons from doing that. In this situation, I know that we have the different entities that have been responsible for the testing would have called the persons to give the results. We don't tend to give the results second hand. It usually comes from whosoever tested you. That's where you're supposed to get the result from. Okay, so we don't, and this follows the normal confidentiality rules in terms of giving out results that we have. Okay.
All right. Thank you very much, CMO, and thank you to all our media colleagues for those questions. We're going to go to our second segment now when I turn over to our minister.
All right, thank you very much. So we're going to move quickly into the 3 quick interviews. We normally try to create a little variety in these press briefings, linked all to COVID. We call them COVID conversations because we do feel that public education on the issues are important from different angles. We have online the 100th patient, patient D, the patient that was released yesterday, and the patient has, we are pleased that the patient has agreed to come on just to tell us about the experience and quickly say how it feels to be that big 100 number and what they're experiencing currently. Patient D, good evening to you.
Hello?
Wow, that's volume is a little loud. Hi, are you hearing?
Yes, you're hearing me?
Yes, hearing you now. How are you?
I'm fine, I'm good.
Okay, how does it feel to be the 100th patient in the context and history of a global pandemic that the last we have seen is 100 years ago? How do you feel?
It seems a little good, but I wish it wasn't.
I think the volume is a little poor there, the quality of the sound. Can you repeat that for me? Sorry?
I heard what you said. It is low. It's low. It's low.
Okay, not hearing at all. I don't know.
Yes, sir, I'm hearing you now.
Okay, you're hearing now. Okay, you have to speak like that, okay, so we can hear you.
Okay,
So,
just turn up
so tell us about how you got infected with the COVID virus. You have any idea? Were you told?
My daughter works with the Portmore call center.
Right.
And through that's how we got it. She didn't know that she had it until they found out and they called her in and when they test her, she have it. So they said the closest to her was come to the clinic, and we went and did the test. When I heard that we have it, 4 of us, her kids and my son-in-law, and the rest then were negative. So when we come up here, I was crying, and I was scared. It was scary. And the lady talked to me and tell me that I should it coming to here. It was so oh my God, man, they deal with us so bad. They embarrass us, they scorn us, they don't talk to us. My daughter had a shop, and the shop had to shut down. It wasn't right. People you talk to, it wasn't good. It wasn't good.
Let me get you correctly there, because you're mentioning 2 issues that I think are worth highlighting. The first is that you contracted or was infected or by the virus by your daughter, who was part of the workplace cluster. You mind telling me how old you are? I mean, you don't have to, but nobody knows your identity.
53 years old.
You're 53, right?
Yes,
so
sir.
it one of the messages coming out of this to all Jamaicans is that, the contact tracing works clearly, because it was the follow-on from a confirmed case that led to the home, and you're saying that 4 others in the household became positive as a result of that one positive case.
That my daughter who got the corona from work.
Right.
Her 3 children and our baby father and myself.
Which
That's
suggests.
why my mother, they said I have to come.
Right.
Because so we came.
How was your experience were you in hospital or home isolation? How did they treat with your case once you were determined to be positive?
Okay. When we first came here, it wasn't that nice, because when we came in here, it was dirty, and we have to use all the people them, and they didn't have the liquid at the time. Mm-hmm. And we tried to work with it, and then my son-in-law called them again and then sent someone to clean up. All right, and another thing was the baby here is not harm for baby, because they don't have what to give the baby. They give them food, yes, but the snacks and those things, we didn't get that. And we were scared. One of the time I said, every morning when I wake up, I thank God to wake up. Because when going to bed, I said, God, my life is in your hands. And all of us. Hello, Mr. Am I talking to Mr. Tufton?
Yes, you're talking to me. So maybe part of that would have been the fear of the illness too, and the uncertainty around that, as you have said earlier.
Oh, yes, and my son-in-law couldn't take it no more, so called one of the ladies from the Ministry of Health and talked to them, because I was crying and all of that. Because when babies cry, hungry and crying, there's nothing you can do. And they said they didn't have anything. And from there, I have nothing. I have no work. Currently, take my work. I do domestic work, and nobody want me to come there.
All right, so you're jumping from the quarantine isolation to the back home and the experiences back home. So you seem anxious to talk about that.
We are not at home. We are still in isolation until the rest of them get their
facility.
Their results.
But what were you saying about the daughter's shop and all that? Tell us about that, because the stigma is a big part of the issue.
Nobody was going back there, and them kind of corners, so them don't want to buy anything. So, and our kids, them are there with our son. This is not a experience I would like to think again, and I wouldn't put that on my worst enemy. No, it's not. In here, up here, they feed you good enough. They feed good, big people, good. But and they talk to you, they tell you if you like sometimes me don't have on the mask, they will call me and say, put on your mask and so.
Okay.
But,
All right, we're going to close it there because we have some other discussions. But I want to thank you for coming on. I want to congratulate you as the 100th patient to be released. And it sounds like your experience wasn't that great, but you're safe, you're better, and that's very positive. And the lesson for us clearly is that the virus is highly contagious, which is why we have to impose the restrictions, which is why even when sometimes persons are not fully satisfied with the environment, it's necessary so as to prevent spread. And secondly, we're going to have to do a lot more as a country and as a people on the stigma issue, because it seems that that is a big problem.
You know how we got through this? We drink a lot of water and we drink a lot of water and steam our face. We steam our face and steam, let the steam go down.
Okay.
So that is easier. That is how we get through. That is how we get through, by steaming and drinking the water, because the water flush down.
So that's your version of the curing of the virus. Thanks a lot, patient D. Appreciate it. All right, God bless you. All the best.
All the best to you too. Sir, can you left something for me? Because I don't have any money to go home.
All right.
That's why I don't go already.
We'll talk to you. I'll talk to you off here. Thank you very much. Just talk to her for me off here, please. All right. CMO, before we go to the other call, the issue of the confinement, you probably can give us a clinical perspective on it, because one of the things that is coming out of the discussions with persons who have recovered and their experience is two things. One, the mental state and the confinement around that. It's unusual, and persons are having a very difficult time coping with that. And the second, of course, is the stigma when they return to their communities. And I don't know, I wondered whether or not you had a perspective on that. We certainly, I think in public health, we probably have to do more to try and address that and allow that as a strategy to accompany what we do currently, even though I know we're doing a lot. You want to spend a minute and just comment on that a little bit, and then we go to the next?
Sure. Yes, Minister. Well, we know that, first of all, there are a lot of persons who have a lot of anxiety and fears surrounding COVID. So that in itself, to manage when you hear that you are positive for COVID, is difficult for many persons. And this, of course, is coming out of the various experiences that different countries have had that have been, it has been seen in the media. And so persons are well aware that there can be poor outcomes, and they, of course, are concerned. Worse if they fall in one of those high-risk groups where they realize that they are at a higher risk of having a poor outcome. So that uncertainty and anxiety is one thing that persons have to deal with. And it is difficult, to reassure everybody, because it is only in seeing your own experience as you realize that time goes by and I'm not doing so badly, my symptoms are improving, that persons will generally feel better. Or even in the exposure that we're having here in terms of some of the positive persons who are sharing their experiences, and for persons to realize that we can have good outcomes, the fact that we have had persons that are recovering and that are going home, that will also help to alleviate that fear and anxiety. The information that we shared today for persons to recognize that the majority of persons in Jamaica that who are positive for this illness will have absolutely no symptoms, and for those that have symptoms, the symptoms will be mild. Many of the positive cases that I've spoken to myself are anxious because they don't have symptoms, and they're wondering, how come I'm positive and I don't have symptoms? And you have to reassure them to say that, well, this is what happens, just like when many people have the flu, very, very mild symptoms or sometimes no symptoms at all. So an understanding of the virus and how it behaves will help persons to calm their own anxiety and their fears. In terms of now taking that anxiety into confinement, because confinement without an additional burden of knowing that you're dealing with an illness is in itself going to bring its own fears, its own problems. Persons that are confined are, and especially if you're used to being free and moving around as most people are, you become even more anxious because you're in a space. And if it is that you are anxious to leave the space, it feeds the anxiety more. And I think that persons have to recognize that, okay, I'm in confinement for 14 days and I'm going to stay here. That recognition and acceptance of that will go a long way in calming some of the fears. If it is that you are constantly fighting, this is not right, I shouldn't be here, I need to be out there, then it only feeds the anxiety more and makes the situation worse. The other thing is that persons in confinement get used to a certain pattern. And there are certain things that they will look forward to. And if those things don't happen, then they become more anxious. So, for example, if I expect my meal at 7:30 and it doesn't come at 7:30, then I become more anxious because it has not come. Because even though it is just a meal, and it may not even be a meal that I like, but I'm expecting it to come. And it is an event for the day, because those things that happen are now events. So just getting 3 meals for the day, somebody knocking at your door and giving you that meal or giving you a bottle of water is actually now things that people look forward to. And when it does not happen in a timely fashion, they become anxious and they become very unhappy and become again, start to, get very angry at times.
So even in confinement, there needs to be some predictability.
There has to be
consistency.
There has to be consistency, because the consistency feed anxiety, and it also now causes people to become angry. Okay. And now they start adding anger to the anxiety, and this can result in disruptive kind of behaviors that will happen. So it is important for persons also. Human to human connection is an important part of human behavior. And for those, there are many persons who may have their phones and they're able to communicate with persons on the outside, but then there are persons who may not. And there are persons who may not have many friends. There are some persons who are very popular and will have many friends, and they can continuously speak to persons, and that helps them through the day. But then there may be persons that don't have many friends, and so therefore for the entire day they're sitting down and nothing to do but to feel sorry for themselves. That also feeds anxiety and fears. And so therefore communication is an important part of how we should manage these patients, to communicate with them frequently.
All right, so thank you very much, CMO. We're going to go into the second quick interview, and we're interviewing a bar operator owner. And I see the bar name on the screen, but I'm not going to call it unless he gives me permission to. Hello, are you hearing online?
Yes, I'm here.
How are you?
I'm good. I'm okay.
I'm going to call you Bar B, unless you want to.
You can say Donovan.
Donovan. All right, Donovan. And,
yes.
don't name the bar. Just name the parish.
Well, I mean, if it comes with I guess some.
No, it doesn't. It's up to you. It's your choice.
Well, I own a bar in Clarendon.
Yes.
Clarendon. Stars HQ.
Stars HQ. Okay, you said it.
Yeah.
So tell me, Donovan, you've heard the announcement. First of all, I wanted to find out, and I'm taking it purely from a public health standpoint. do you understand and appreciate the justification for the restrictions and what those restrictions are, and then tell me how you plan to cope?
Well, yes. I mean, I understand the rationale, the need to basically follow the protocols that are established in general for the country.
Mm-hmm.
And as it relates to the bar, the fact is that there is a risk involved. You have persons who are gathering in close contact and not following the protocols. Yes, you're going to have a problem. So there's a risk. So understand that. As it relates to, I can speak for my bar, but I can also speak in general because in Clarendon, as you know, there's a sort of a high percentage of the small operations are actually bars. And we have a lot of round robins. I understand those are basically outlawed at the moment. Understand that. So I can speak in general from my place. It will require me to do some amount of reorganization, some investment, I would say, because I didn't have, for instance, a sanitization station before. I now have to put that in place. The heating, I'll have to basically remove that. I don't necessarily agree that that is the best way to go, because I believe if you have heating in place, it probably will help us to maintain social distance, as long as you have the seats at a certain distance apart. If you don't have the seating, it's probably more difficult for the bartender to sort of ensure that persons are a certain distance apart. Mm-hmm. So I wouldn't necessarily agree with the no seating situation or no stools in the bar. I think that would probably assist us better if we were to keep the seating and keep the distance. That would probably assist the bartender. For the other thing, it will require, for instance, to ensure that persons have masks. You know, the problem is that if someone comes in without a mask, and you know, you wouldn't necessarily want to turn them back. So I may have to, for instance, have some masks available and stuff like that. Mm-hmm. So it will require some additional spending. The difficulty I have with the timeline given for us to comply, because you have 2 weeks as a trial. That's what was indicated. So for me to put some investments in place, knowing fully well that if it doesn't work, and it is literally, it's all dependent on how well we comply. But if it doesn't work, it will mean that that 2 week period is not enough for me to even consider recovering my investment. So I think in terms of a trial period, I would prefer to have a longer period. I have some space. So, for instance, I can, ensure that, for instance, the social distancing is maintained and adhered to. But a large percentage of the small bars, and most bars, community-type bars, are small operations. You say, well, all right, no more than 4 persons, including the bartender. But a lot of these places, if you were to have even 3 persons in those small spaces, you wouldn't be able to maintain social distances. So maybe another idea that you could probably introduce is for those operations that cannot ensure that the 6 feet apart social distance is maintained with more than 1 person in the bar, for instance. They will probably have an opportunity to continue the operation by serving through a window or something like that. So that would probably assist.
All right.
But in general, I must say, we are thankful for the fact that at least we get the opportunity to reopen. They say half a loaf is better than none at all. Whatever it takes to make sure that we can open, we can at least earn something and keep the bartenders sort of employed, we'll try to do that. So, for instance, I have been, talking to my bartenders and also, a contractor to come in and try and make sure that we have the place basically
So
fitted out.
Donovan, you sound like Stars HQ is a big time bar. I mean, your bartenders and your contractor and all that. In closing, and I think you've articulated well in terms of some of the concerns, and you have demonstrated an understanding as to why the measures are important, and I appreciate that. And what I'd like you to do in 30 seconds is just tell us what would the advice be from you to your colleague bar operators and owners as it relates to the importance of this measure and how they should operate. Give some advice, because you sound like you're a serious bar experience proprietor.
Well, first of all, I must tell you that almost all bars will operate with 2 bartenders, and they rotate basically because of the clientele that they serve. You basically have to keep them sort of refreshed and rotating. So you have more than 1 bartender basically. They rotate. They don't work all at once, so to speak. But the fact of the matter is that I think most of the persons who I've spoken to, and I have quite a few friends who have bars, and they are anxious to get this thing going. They want to comply. It's probably going to be difficult for some of them to comply fully. For instance, to get the sanitization stations in place and all of that. To have 4 persons in a small space, that they don't have that sort of luxury. But I think most persons are happy that we at least have the opportunity. I believe that we should get more than 2 weeks to try and get this thing going. And I think most persons are going to go and basically comply with all of the requirements.
Thank you very much, Donovan. I appreciate your coming on, and I know persons are listening, and I really hope that all bar operators think the way you are, very proactive and willing to comply. And I think if that's the case, you'll have a lot more than 2 weeks. All right?
Okay.
Thank you. While we get on the line, or the religious the leader, I'm going to ask the CMO just to complete what she was saying about the mental state, and she gave an assessment of the issues, maybe some recommendation as to how to cope.
Right. Thank you, Minister. Yes. So I would now say, okay, we see all the reasons why people become anxious, and anxiety can turn to anger. But how do we address this problem? I think, first of all, persons need to resolve themselves to why this is being done. They need to accept that it's a necessary measure, believe it is a necessary measure, and understand that they're protecting themselves, they're protecting their families, their community, and by extension, the country. So your confinement, yes, it's difficult, but why is it necessary? You may have an elderly person in your family, or even somebody that lives next door, somebody that you would have met on the street if you were at home walking around, somebody you could have met in the supermarket, who you don't know that they are at risk. You don't know what kind of chronic conditions they have, and you may unwillingly pass on this infection to them. And while you may not have such a bad course, then this is a person who could have a bad course. So understand why it is that it is happening, and resolve yourself that this is a necessary action that I need to go through. Now, in terms of coping with the time, you need to make some plans. First of all, plan some activities that you're going to do during this period. You can read, you can watch TV, exercise. Exercise is good. It releases the natural hormones in the body that makes you feel well. Give yourself a routine. You haven't had a break in a long time. This is now a time maybe just need to just take a break and rest. Sleep for the first 2 days. And then, get yourself into a schedule to start an exercise program that you could never had the time to do before. Keep a diary. Write a diary as to what happens to you on a daily basis, your thoughts. 5 years down the road, you're going to share this with somebody to say, I was a part of this epidemic, and this is what happened to me. These are my thoughts. somebody who's going to want to interview you after. Write down your thoughts so that you are able to share them. Try to get to do some activities during the day. The third thing is that remember that anger feeds anger. Discontentment feeds discontentment. And usually you are the person that suffers the most. And especially if you're in quarantine, you are probably going to be the only person that suffers from your own anger and discontentment. So you need to address yourself very early to calm yourself down and to recognize that I need to stop thinking like this. I need to start thinking positively and, to help yourself to get through to this time. So it's not an easy time, but make the most of it. As I said, many persons have not had an opportunity for years to sit down and just to sort themselves out, to think where it is that I'm going, what am I doing with my life, how it is that I need to organize myself and to solve some problems that I've never had a chance to sit down and do. Use the time effectively so that at the end of the time you can feel a little of contentment in terms of, I've gotten through this and I've accomplished some things while I've gotten through it.
Okay, thank you very much, CMO. And essentially what you're saying is set an agenda for yourself, knowing that you're going to be in isolation or quarantine for a period of time, and do something that is unusual to occupy your time. All right, so we have Bishop online, Bishop Franklin Beckford, Dr. Franklin Beckford, and we want to just welcome him, and we wanted to get a perspective from him as to the new measures as announced by the government, the rationale in his own view as to why these measures may be necessary, any concerns, and how he plans to cope. Bishop Dr. Franklin Beckford, welcome to the program.
Thank you, Minister, and a very good evening to you, sir. Thanks for having me on the program.
Good evening. Bishop, if you want to share with us where your congregation is located, we're fine with that, if it's up to you. And then I wanted to ask you to just quickly tell us your own interpretation of the measures and why, if there are any concerns, and then, of course, how you plan to implement.
Okay, so first of all, I want to commend you on the Ministry of Health for the wonderful work you have been doing in terms of helping to contain this pandemic. I know it's a hard work, and we really want to commend you and applaud you and your team. As it relates to the church, I am an overseer in the Church of God of Prophecy, and I pastor the local church in Hopewell, Hanover, and also White House, Westmoreland, two congregations with membership of over 300. Mm-hmm. And so we are looking at how we are going to approach this new era. Of course, we are prepared as a church to abide by all the protocols, because as the Christian church, we must maintain law and order, help to maintain law and order, and we must set examples as Christians. So, sir, I want to assure you that we will observe all the relevant protocols and try to adapt, because we know that the measures taken are for the greater good of the society and also to maintain a healthy nation. And as a church, we want to do our part in ensuring that where our members are concerned. So as a church, we're preparing ourselves to do all the sanitizing of chairs and sanitizing our hands. Of course, we realize the social distance. We must observe that as well. And for some congregations, we will have more than one, at least 2 services for the day. And when that is done, we will ensure, of course, upon entering the building, there'll be sanitizers. And just today, I procured for my churches the handheld temperature tester. We want to ensure that we observe all the rules.
Okay, thank you, Bishop. And firstly, I know that you're based in Hanover and White House, Westmoreland. Right. Hanover has reported no case to date. That's right. And I want to commend the Hanoverians, the people of Hanover, and of course yourself for the efforts, and encourage you to all keep it up, because we want to ensure that we remain that way.
Healthy and safe in the nation, sir.
Well, let me ask you, and I hope you won't think I'm being in any way disrespectful, because that's not the intent. But there are some criticisms that I've seen online and other places where persons say, well, you're going to restrict the work of the Spirit to move inside of individuals that may actually cause people to move around, which is understandable. How do you maintain the social distancing with that challenge, or I mean, what provisions do you think could be put in place to deal with that?
We are a Pentecostal group, and we encourage our people, we educate our people, and we know that the Spirit is subject to the prophet. And so while we are exuberant in worship, we are aware that we are in a contained and a confined space. So persons are told that you must operate within a certain framework. We are not so over spiritual that we can't abide by the rules. We are intelligent people, and we serve an intelligent God who guides us. As it relates to the movement, many of our churches have ushers who will usher you in and out of the building. And so there are times when persons become a little bit exuberant. We have ushers who will maintain a space, which we normally do. Maintain a space so that persons, if they are to be slain in the spirit, or if they are to a little bit exuberant, then we offer some guidance to that. But we are also aware of that, and we are thinking about that as well, sir.
And I think that's a very reasonable response. And those who question the capacity of the church to abide by the rules should bear that in mind. You have ushers who are properly placed and who have particular responsibilities and so on. Finally, what advice, if any, would you give to others, whether they are part of the congregation or part of the leadership, as it relates to the announcements and going forward?
All right. Minister, I must say that I am very grateful to you and the team, the authorities, that you have thought of reopening church on what I call on a phase basis. I want to thank you and to express my appreciation. And so we would want to do anything to damage that. We would want to maintain all this, the orders or the protocol, so that in another few weeks, we can go back to some semblance of what we are accustomed to as normal. We know that the way forward, we are now having what you call the new normal. So right now, many churches, we are adapting, we are having Bible studies online, we are using Zoom and other social media platforms. Just last night, I had Bible study on Zoom. And many churches are doing that. Churches are happy because most Sunday services were conducted on Zoom. And so Saturday and Sunday, persons will be going out in small numbers based on the square footage. So we are looking into all of that.
The influence of the church is very known. And so, as part of government, I would like to encourage all, the church, in generally speaking, to continue to collaborate with us as we confront this virus, this public health threat, and to help us with the messaging, as well as, of course, leading by example. And so far, so good. We want to commend the church generally in the broadest sense, because initially they were encouraged and they volunteered to take certain steps. And now that we have imposed some specific guidelines, the feedback so far has been positive. So thank you very much, and keep the faith. Thank you.
Thank you, Minister, and we are praying for you and the good work you have been doing. Each time I look at you when you're doing your press conferences, I say a little prayer for you.
Thank you.
And the CEO. So thank you, sir, and we look forward to greater things. And we are saying to the nation,
also,
this too shall pass.
Please, I beg you, pray for the PS2, because he likes to be mentioned in these things.
And of course, Dr. Jacqueline, this is, oh Lord, you have a wonderful team, Minister, and the church is praying for you. We are out here on the field and encouraging our people. I must say this. Some persons have a little concern about wearing masks, but that's fine. That's fine. We are not the kind of person who are complaining about the mask. We will do what we need to do, sir, to ensure that we get back to church and maintain a healthy society.
Thank you very much, Bishop, and all the best to you. God bless.
God bless you, sir.
And
thank you very much for having me. I appreciate it.
Thank you. And on the issue of masks and the wearing of masks, we want to close We're 15 minutes over the hour and a half that we have scheduled, so we apologize, but we did start a few minutes late. Thank you very much for listening. Thanks to the media for joining us, for asking questions, for helping us to spread the messaging. Thank the production team, of course. Thank the team beside me on both sides, the PS Brand and CMO Bisesa McKenzie. And, you know, ladies and gentlemen, this is intended to provide information, the data, but an analysis or assessment, if you will, behind the data. And we think it's useful, and we certainly hope that persons would take it for the way it is intended. And where they're not satisfied, please feel free to use the 888 One Love number as we continue to tackle and to overcome and to take on the coronavirus challenge. So on the issue of masks, we normally close with a little video presentation, and this evening we are going to give you a very short presentation on the proper use or wearing of masks. A lot of persons I've seen wearing masks in a way that really bastardizes the process, but more importantly, represents a greater public health risk than it solves. It's on their forehead, it's under their chin, it's in their eyes, it's below their nose, they're biting it, they're touching it, and you know, I'm not a clinician, but the guidelines I've read suggest that if you're not following the protocols around masks wearing, then it could also represent a public health risk. So we endorse the wearing of masks under certain circumstances, as we have said, but please try to wear it properly and watch this video. It may give you some ideas as to how to go about that. Otherwise, thank you very much. Have a good evening.
Hey everyone. The point of wearing a mask is to prevent the spread of air droplets from persons who may or may not be infected. When wearing a mask, please ensure that the mask goes above the nose and below the chin. The position of the mask is very important. It should not be worn on your forehead, under your chin, or on your neck. This might be a bit uncomfortable, but it's for your own safety. People, trust me, if you have on a mask, we will still hear you. Please do not remove the mask when speaking. This actually causes more droplets to be released into the atmosphere. When you're removing a mask, try not to touch the front of the mask. If you do, remember to wash your hands or use hand sanitizer. Please throw away the mask appropriately. Remember, partial protection is better than